Okay, recognizing the heart is not a pump. What is a heart attack? So the first thing I would say about that is whether the heart is a pump or not has nothing to do really with heart attacks. Those are completely separate issues. In other words, if the heart is a pump, then you could still have heart attacks based on what I'm about to say. And if the heart isn't a pump, it would still apply. And so the confusion may be that I put them in the same book, meaning half of the book was about the heart is not a pump. And what I mean by that is a pressure propulsion device, meaning it pushes the blood. The reason the blood moves in the body is because it's pushed with the generation of pressure from the heart. So that was the first part of the book. The second part of the book was that blocked arteries don't cause heart attacks. So again, I've been over that, and I can, but let me just give you a brief summary of that. So if you ask everybody from the person on the street to the head of cardiology at Mass General to all the internists and all the ER doctors, why do we have a heart attack? What causes heart attacks? They all say the same thing, which is we have these three major coronary arteries. Those are the big arteries, and they carry all the blood that goes to the heart. They may not actually say that, but that's what we're taught in a sort of normal sense. And if one or more of those coronary arteries gets blocked, then the blood can't get through the blockage, and the area of the heart downstream from the blockage doesn't have enough oxygen and fuel and food, and it can't get rid of waste products, and then it feels pain, or you feel pain based on the not getting enough food and oxygen in that part of the heart. And if it continues, then it dies, and we call that a heart attack. So that's what everybody thinks. The argument, and you know, if you look into so-called holistic cardiology, they would claim that they agree with that basic idea of why we have a heart attack, but they have complaints or quibbles about what causes the blockage. So typically holistic cardiologists, or I would say so-called holistic cardiologists, say, yes, of course, the blockage is the problem, but the blockage is not, say, from eating a high-fat diet or cholesterol. It's from an inflammatory process, or maybe even an infection with mycoplasma or heavy metals or something like that. So everybody, as far as it goes, agrees that the blockage is the problem. And this, of course, has led to conventional therapies like bypasses and stents, which obviously either clear out or bypass the part of the artery that's blocked. And in the alternative world, the holistic world, it has led to using things like chelation to get rid of the deposits that are blocking the blood vessels. So everybody agrees it's a blockage. It's just they disagree on the source of the blockage and maybe even what to do about it. And of course, then there's me, who doesn't agree with any of that. So why don't I agree with that? So the steps in how I got to that were basically just like always. I started asking myself certain questions. So the first question was, if there's something in the blood that's blocking, that's causing the buildup of plaque in the artery, I asked myself a simple couple of questions. Number one, are the arteries all over the body. In other words, the artery to the spleen, the splenic artery to the liver, the hepatic artery to the leg, the femoral artery, carotid artery. Are all these arteries identical, anatomically and morphologically as the coronary arteries? And as far as I know, everybody thinks they are, including me. So that's something that I uncharacteristically agree with everybody else. There's just one kind of artery. All the arteries are the same. And in fact, we can even substitute one artery for the other, or even a vein. That's what a bypass is. You put a vein from one place and put it into your coronary arteries, and it sort of functions reasonably normally. So all the arteries are the same. Next question. Is the blood the same everywhere in the body? In other words, is the blood in your coronary arteries the same as the blood to your foot, blood to your spleen, liver, kidneys, etc.? And again, I think everybody agrees, including now me, that that is true. There's sort of one blood, and it's just circulating around the body, and there's no evidence that you have a special blood that goes through your coronary arteries and a different special blood that goes through your splenic artery. If that's true, I'd be open to hearing about it, but as far as I know, that's not the case. So if those two things are true, then if there's something in the blood that's causing the blockage, like too much cholesterol or too much inflammation or too much metals or too much infection, why wouldn't that happen everywhere? Same blood, same arteries, so you should get blockages in your splenic artery and blockages in your hepatic artery and femoral artery and coronary arteries. And to a certain extent, you do. So you do get plaque buildup in your splenic artery, just like you do in your coronary artery. Why wouldn't you? Same blood, same stuff in the blood. I mean, if the drugs like statins are meant to lower something in the blood, that's presumably all of the blood. Okay, so now we know that according to that way of thinking, the blood is the same, the arteries are the same. You get plaque in your splenic artery, you get plaque in your coronary arteries. And then I've had occasion to ask, let's say 50,000 people. I don't know if that's the right number, but some number like that. Because I ask it every time I give a lecture on the heart and heart attacks. How many out there have ever heard of somebody, know somebody, personally experienced, or know of some famous person who's had a heart attack? Everybody raises their hand. Bill Clinton, Dick Cheney, you name it. Everybody knows Uncle Fred had a heart attack, etc. Okay. How many people know somebody who had a spleen attack? Nobody has ever raised their hand, except one guy who turned out to be an ER doctor. And I asked him afterwards, because when I was an ER doctor, I never saw anybody who had a spleen attack. And he said, "What do you mean?" He said, "Well, a guy who was in a car accident and had a ruptured spleen." And I said, "That's not a spleen attack. That's a ruptured spleen." So that's ridiculous. So nobody ever has had a spleen attack or a liver attack or a foot attack. The only two places are heart and brain, which we call strokes. So that was the first thing that got me interested in something smells rotten here. Why is it only these two organs have attacks? There must be something different about these organs than it is about the blood vessels or the plaque buildup, because that's got to be the same. So the next thing is, over the years, especially in my primary care work, I don't know how many people, let's say 100, who came to me with approximately the same story, which is, I'm a 50-year-old male and I went walking up this hill and I had some chest pain, and my wife says, "You better go to the cardiologist." So I go to the cardiologist and he does some exams and tests. And he says, I have a 95% blockage of one of my major coronary arteries. And then usually he wags his finger at him like this and says, if you block any more, you're going to have a heart attack and die. So I thought to myself, okay, if it's true, as I was told, that all the blood goes through these three major arteries, they just found out that you have 5% blood flow to a major part of your heart. That's almost zero, essentially zero. How is it that you walked up a hill and walked into my office and, you have some symptoms, but you're basically normal? How do those things go together? And then, is it true that if you block from 5% blood flow to 3%, which I would submit is an insignificant difference, then you're going to die of a heart attack? And that made no sense to me at all. Just cannot be. And in fact, most of the people who have bypasses and stents, that's exactly their situation. They have minimal to mild symptoms. And as we now know, all the studies that have been done on bypasses and stents show they don't increase longevity, they don't prevent further heart attacks, they don't prevent further hospitalizations. And it turns out, even though we used to think they stop chest pain, otherwise known as angina, in the Lancet study, I think 2018, they did the first sort of blinded study. They took about 50 people with chest pain and they did a stent in half of them. In the other half, they did an operation, told them they put a stent in, but didn't. And 8 weeks later, they had the same number of symptoms, showing that even doing stents had no effect on their chest pain. Headlines were stents proved useless. So that was my second reasoning, that there's something more here. And in fact, that also demonstrates that it's not possible that the blood flow is only through these three coronary arteries. And the final one was, I actually read a book by an Italian pathologist named Baroldi. And by the way, if you're interested in this subject, there's a website called heartattacknew.com. That's heartattacknew.com by a guy who knows all this whole story about heart attacks. And he has a great video in there, which everybody should watch. And there's an actual picture of the blood flow to the heart, showing that at least 90% of it is not through these major blood vessels, but through what are called collaterals or capillaries. And so the reason why you can live with a 95% blockage is most of the blood flow doesn't go through the coronary arteries anyways, goes through the collaterals. And it turns out if you have a blockage in one of those arteries, then you make more collaterals and you actually might end up with a better blood flow than you started. But on that website, I haven't checked it for a few years now, but it's probably still there. At the bottom, there's a print version by a book by a pathologist named Baroldi. And he studied with autopsies people who died of heart attacks for about 40 years. And he found out that exactly 41% of people who die of a heart attack, so that means they have a heart attack and they acutely or immediately or soon die, so these are the worst of the worst, 40% of them had a blockage in the artery leading to that part of the heart. In other words, 60% didn't. And he was able to determine that half of those blockages came after the heart attack, not before. So in other words, if you do the math, 80% of heart attacks at least have no blockage in the artery leading to that part of the heart. at any time before the heart attack happened, which means it's not possible that it was the cause of the heart attack. And so we're now down to 20% maybe have a blockage and 80% don't. So the question then, like this person asked, is what is the heart attack or what causes it? So now we know that it has nothing to do with the blood vessels. It has everything to do with the organ itself. So what's the difference between a heart and a foot or a spleen? And so basically, here's what happens. We generate energy basically by the metabolism in our mitochondria, doing something called oxidative phosphorylation, which is turning oxygen and food into a chemical called ATP, which is not energy, but it helps unfold the proteins so they can structure the water, and the structuring of the water creates an electromagnetic charge, voltage, that actually is the energy of life. If there's not enough ATP because there's some sickness of the mitochondria, then the tissues have a backup plan, which is called fermentation. And that is a non-oxidative way of generating energy, or ATP. A lot less ATP is generated and lactic acid is produced. This is also called anaerobic glycolysis. And this is thought to be exactly why, or one of the reasons why people get cancer as well. So there's something wrong with your mitochondria. You can't use oxygen. Then you start fermenting instead of respiring, and you make much less energy, much less ability to unfold your proteins. And then you build up lactic acid. And just like in your muscle, if you build up lactic acid, you have pain and cramps, and then your leg stops. If it happens in your spleen stops. And if it happens in your liver stops. If it happens in your heart, you have chest pain called angina. You can prove that there's a buildup of lactic acid in the tissues, and there's an acidification of the tissues. It has nothing to do with eating acid or alkaline food. It has all to do with the fact that your ability to respire or use oxygen is compromised. And so then you build up lactic acid. The difference between your brain and your heart is they use much more fuel, much more energy than any other organ, and they can't stop. The heart has to expand and contract. That's different than pumping, but it is a muscle, and it is part of the circulation. It expands and contracts. It can't stop, so the lactic acid continues to build up, and then you get an acidification of the tissue, which then destroys the tissue in a process we call necrosis, and that is what a heart attack is, period. All heart attacks go through that process. Now, once that happens and the tissue dies, it's like putting a dam in a river, and then upstream from the river, you get debris built up, which is exactly why you see debris or blockages or plaque in the artery leading to that part of the heart attack after the heart attack, not before. And that, of course, confuses the cardiologists and doctors, because they go in and they see blockage, but they don't realize that happened after, not before. It happened because there was a damming effect in the tissue of the heart upstream. It got debris buildup. It's just normal hydraulics. And that's exactly explains everything we see. Now, the only remaining question is what happened to your ability to, what happened to your mitochondria, which generate ATP or energy source? And that could be, that's complicated. Metals poison your mitochondria. Antibiotics are a huge culprit because essentially mitochondria are old-fashioned bacteria. So anytime you take an antibiotic, you essentially poison your mitochondria and make yourself much more prone to having a heart attack or cancer. And finally, and a big one, is electromagnetic field poisoning, which we know interferes with your ability to utilize oxygen and respire, and it has a negative effect on your mitochondria, as does blue light, as opposed to red light, which stimulates, acts as food for your mitochondria. So anytime you're poisoned or starved or subject to fields, you will have a negative effect on your mitochondria. You won't be able to respire. You'll build up lactic acid because you're using glycolysis instead of oxidative phosphorylation or respiring. And that's why cancer and heart attacks are basically two sides of the same disease. By the way, our medicine Strophanthus contains a substance called wabein, which is essentially the only substance known that gets rid of the lactic acid in your heart. And again, on the heartattacknew.com website, he goes over the studies, but it's very clear it converts lactic acid into pyruvate, which gets rid of the central poisoning player in this drama. It has been known for 70 years that in all cases of heart attacks, there's a acidification, lactic acid buildup in the tissues. Strophanthus wabein converts that into a fuel. So the poison is converted into a fuel, stopping the process in its tracks, which is exactly how and why it works.